Okay, our next conversation is with Dr. Brennan Spiegel. He is going to be talking to us on immersive technologies. Dr. Spiegel is with Cedars-Sinai out in California, and he really is a visionary who's taken the concept of the mind-body connection and translated it into clinical reality. Dr. Spiegel is a physician scientist. He's a practicing gastroenterologist and the director of health services research at Cedars-Sinai Medical Center out in Los Angeles. He holds the George and Dorothy Gorich Chair in Digital Health Ethics. So he's not only developing the technology, but looking at how it is supposed to be used ethically. And while his clinical roots are in gastroenterology, Dr. Spiegel's work really transcends any single organ system and focuses on the most powerful therapeutic target we have, which is the human brain. Dr. Spiegel is a global pioneer in what the medical community is calling medical extended reality. And he's the architect of one of the world's largest and most rigorously studied medical virtual reality programs. Through immersive VR and AI and wearable biosensors, his research has demonstrated that digital therapeutics can do far more than distract patients. It can actually rewire the neural circuits, reset dysregulated nervous systems, and treat chronic pain without reliance on opioids. He is the editor-in-chief of the American Journal of Gastroenterology and author of the definitive book on VR, which is VRX, How Virtual Therapeutics Will Revolutionize Medicine. Dr. Spiegel is reshaping how healthcare is really genuinely delivered, and he's showing us that healing can occur not only through pharmaceuticals and procedures, but through carefully designed digital experiences that engage neuroplasticity itself. So Dr. Spiegel is going to share how immersive technologies are becoming a new class of medicine, how they harness the brain's innate ability to change, and what this means for the future of pain treatment and whole person care. So welcome, Dr. Spiegel. Thank you so much for joining us.
Well, thanks so much for having me. I appreciate the introduction and the opportunity to be with you guys here. I'm going to start by sharing my slides and we will get started.
Okay, all yours, Dr. Spiegel.
Okay, well, thank you again for that kind introduction. And I'm going to start with a picture because although I'll be sharing a lot of data with you, a lot of what I'm going to talk about comes down to stories and narratives and individual encounters with patients. And we learned a lot about how the nature of pain can be modified through the power of simulation itself. And so in this picture, and this is with the patient's permission, as will all the pictures that I show today, is me with a person who has chronic pain. And at this moment, she's contemplating whether to use that virtual reality headset to help manage her pain. And I'm going to talk about why would we do such a thing? How could something like virtual reality help with pain? Why would it help with pain? What does it do in the brain? What does it do in the body? Is this something that you should be considering? Could you become addicted to this? Should you be using it long term? What's going on with virtual reality for pain? So that's what I'm going to be talking about today. Now the subtitle though, I updated it just a bit, is the rise of spatial computing in medicine. We're here to talk about pain, but the idea of spatial computing, which is what I'll talk about, we've come to realize can impact many aspects of well-being beyond pain itself. So I'm going to touch on some of the other ways that we're using virtual reality in our hospital at Cedars-Sinai, and hundreds of hospitals around the country and the world now are using virtual reality as part of everyday care. So to get us started, I want to show this picture. If you were to be floating over this river, you might feel a sense of calm. If you allowed yourself to immerse into this world, you might actually affect your heart rate, your breathing rate, your pupils might change diameter. You might have a very real physiological effect for just simply being in a calming environment like this. Now, as you probably can imagine, I used artificial intelligence to create this video. It's not real. Even if it were a real video of a real place, it would still be virtual on your screen. there would still be pixels moving on a two-dimensional screen, convincing your brain that you're experiencing some semblance of a natural world. And as we'll see today, there's something very powerful about our ability to simulate the world. In the end, there's no substitute for real reality. We're going to call that RR today. But virtual reality has its role when needed, in the right place, in the right time. And I'm going to show you some examples here of how virtual reality can very genuinely affect the body, the brain, the neuroendocrine systems, the immune systems, your white blood cell count, just by looking at a picture like this. Now, this is on a two-dimensional screen. We're going to be talking today about three-dimensional screens using these types of technologies. Now, some of you may be familiar with virtual reality. Maybe you've used it. Maybe you have kids who have used it. Some people think about this mainly as a platform for gaming and entertainment. Maybe they think about teenagers playing first-person shooter games or spending time in their basement in virtual worlds. Not ideal way to spend one's life. And that's a big issue. But it turns out long before Mark Zuckerberg knew anything about, virtual reality, before he created the, Meta, for example, long before all of that, as far back as the 1950s and 1960s, elite laboratories around the world were starting to evaluate how this type of computer experience could change the human brain, especially in psychology departments in major universities. And they started to realize that this is a very powerful technology. And like any powerful technology, it could be misused or it could be used correctly. And psychology departments started to see that it could help with pain. It could help with anxiety, not by causing people to escape the world, and disappear from it, but to learn something about their mind and body through these devices, and then return back to the real world with new information, new orientations. And so that's what I'm going to talk about, is what hopefully is the more positive use of VR. But to orient you first, I want to show you a video. And I'll play this in a moment. And you may be wondering, what are we looking at here? This is actually a video of the very first time that I used virtual reality. This was all the way back in 2016. So this is 10 years ago. And a group came to my office and wanted to show me how virtual reality works, because they were interested in the possible pain benefits. But before they showed that to me, they put me in this virtual reality headset. And next thing I know, I'm going up a window washer rig up the side of a 50-story building. And this is literally me looking around. You can hear the creaking cables. You can hear the motor running. I'm looking around and noticing these details, like the gleam of the metallic bar in front of me, and the little dents on that bar, and those cars down below, and there's somebody talking to me, and there's paint splotches on the ground. And I'm kind of afraid of heights. And I'm thinking, well, at least I've got that rail there to keep me from injuring myself. And then they release the rail. It falls 50 floors, it hits the ground, makes that noise, and I just snap back. And I'm looking down, and I'm just scared. I can literally feel my pulse racing. I can feel the sweat beating up in my hands. And I thought, there's no way I'm going to jump off this thing. And they said, just go ahead and jump off. I said, I'm not going to do that. They said, you know that you're standing on carpet. I said, my feet know that, but my brain doesn't know that. My brain thinks that I'm about to die. My brain thinks that I'm experiencing an existential moment. Well, I was able to eventually jump off. It was very hard for me. And this is me falling 50 stories, and then there's a total whiteout, and I'm gone. And that's the first time that I used virtual reality. And I thought, wow, if we can use it for evil, then maybe we can use it for good too. Maybe there's a way we can leverage this capacity to experience this immersive world so vividly, but do it in a way that can help people, not scare them to death. And so here is another picture now that was taken a couple years later when we started to examine how could we use this technology for people in the hospital, not to practice jumping off buildings, but to go to fantastical worlds at moments when they are vulnerable and when they are in pain. What does that do to their experience of the pain, of their experience of the hospital? This is a picture of a patient with a rather old headset now that doesn't even exist anymore. That's a Galaxy S7 phone snapped into a Samsung Gear VR headset that doesn't exist anymore, but it didn't matter. Even that old technology was powerful. And this patient, moments before we took this picture, was doubled over in pain from sickle cell anemia. He was having pain in his long bones and his chest and was doubled over. But at this moment, he is flying over fjords in Iceland on a helicopter. And you can see the emotional experience on his face. And this is the first of three principles I want to start off with. The first is that emotion matters. And what I mean by that is, if you think back to the most powerful experiences in your life, both the positive and the negative experiences, and the memories that you have of those experiences, they're almost all driven by a strong emotional experience. It was the emotion that burned that memory into your brain. And we know this because we learn through storytelling, which has an emotional component to it. And so that's why I'm showing you pictures right now rather than a bunch of bullet points. Because if I showed you a bunch of bullet points, you would be checking your emails and smartphones and not being able to focus. And maybe that's the case anyway, hopefully not. But most of our brain, about 50% of it, is dedicated to visual processing for sighted people. And not just the occipital cortex, but all the secondary areas around that are processing the tremendous amount of visual data that we're experiencing in the world. And it turns out that if we can tap into the emotion centers of our brain through visual experiences, then that can change how we learn. And that's a powerful insight, that emotion matters. And what happens in virtual reality, you can see here, is it feels literally like you're there. Even though intellectually, you know you're not on a helicopter in Iceland, you know you're in a hospital room, viscerally, you literally feel present, and that's called presence. That's the term psychologists use. And that's because we never evolved to have to live in two worlds at once. We don't know how to disambiguate worlds. This is a picture of me with Dr. Omer Liran, who is a psychiatrist that we work with at Cedars-Sinai, who actually is also a programmer and a developer. And here we are using virtual reality with a patient in the hospital, and she is also experiencing pain. This particular headset has biosensors embedded within it that is allowing us to measure her heart rate variability, the beat-to-beat variations in her heart rate, her pupil diameter. And we're monitoring that on the computer. And an AI system is taking in her biodata and changing the environment to keep up with her own biodata, to try and countervail it to a more calming state. And I'll show you later a video of her actually using the virtual reality. Now, if you look at this picture, in the foreground, there are cables. And I kind of find that metaphorically relevant. It's almost as if she's surrounded, not just by the four walls of her hospital room, but by the four metaphorical walls of her illness experience. And what we can do with virtual reality is give people the ability to escape the moment, not to escape life altogether, but to find ways to zoom out of their body and look back upon it. This is the principle of talk therapy. When we talk with somebody else and filter our life experiences through another mind, who then reflects that back upon us. And that's a very powerful way to gain perspective on one's mind-body complex. And it turns out virtual reality can do that too, a form of escape. So the first concept is that emotion matters. The second is that escape matters. This is an example of one of the visualizations that we use. This is widely available commercially. I have no relationship to the company. It's called Trip VR, Tripp VR. If you have a headset or you want to buy one, you can go on Amazon and you can get a Meta Quest, for example, and download this software. We use this with many of our patients. It's called a cyberdelic. It's like a psychedelic, but it's a computerized psychedelic. It appears to work in some ways like a psychedelic by inhibiting one's sense of self through the default mode network of the brain, and creating a sense like you've been transported elsewhere with this sense of oceanic consciousness, like your consciousness itself becomes distributed beyond your immediate sense of self. It's very powerful, and I've actually used it quite a bit myself. Now, this is Harmon Clark, who's allowed me to use his name, show his picture. He is not only a patient, but he has actually become my graduate student, not to mention my yoga instructor. So we have really developed a close relationship, and it started when he was in the hospital, very ill with fungal sepsis from Crohn's disease and a surgery that he had, severe pain. And he was struggling, and we came in and used virtual reality. And he liked to go to outer space. He said for him, escaping the planet and looking back upon it gave him a sense of awe and wonderment. And this sense of awe is very important. Awe is the feeling like you're part of something greater than yourself, like you're part of something cosmic. And the feeling of awe can go in two directions, depending on your orientation to it. It could be awe-inspiring and beautiful, and it can give you a sense of meaning and purpose. Or if you feel like you're insignificant in relation to the cosmos, you can feel existential dread. This is why chills happen, both when you're scared and when you're awe-inspired and listening to beautiful music, let's say. Both of those experiences give us literal chills down some people's backs. And so what we try to do with virtual reality is not, of course, promote existential dread, but promote a sense of wonderment. And it turns out that this has been studied, and there's a biomarker for awe. It's shown here. It's goosebumps. Not everyone gets goosebumps, by the way. You know it if you do. If you listen to beautiful music, like Pachelbel's Canon always does it for me, maybe it does it for you. Maybe there's some other experiences that give you those goosebumps. That is your nervous system lighting up. And what that can do for your body is very positive depending on how you're experiencing it. Hopefully it's not fear or anxiety that's causing your goose flesh. And it turns out this has been studied. This is a study called Are You Awed Yet? How Virtual Reality Gives Us Awe and Goosebumps. It's a study from Canada, from Simon Fraser University in British Columbia. And what they did there is they took research participants and they put them in virtual reality, and then they flew them over their city, which here is Vancouver, then over the Canadian Rockies, and then they blasted them straight up into outer space. And they looked back upon the planet, as I showed you in the last picture. And the whole time they had this experimental setup. They had something they called the Goose Cam, which is a camera that was entrained on the forearm, where they could actually monitor goose flesh. And this was a biomarker that they studied, and they found this dose-response relationship. The sooner somebody gets in, pretty much as soon as they get into space, the goose flesh comes out. It didn't happen to everybody, about 50–60% of people. And when that happened, they reported this sense of beneficence, a sense of empathy for self and for others during this experience. And so this is a little bit of the research in this space in terms of physiological effects of virtual reality. So these are the three experiences I wanted to start off with, and I'll start talking in a bit about the research we've been doing with pain. But this is the psychological concept of emotion as a driver of learning, of a driver of memories, of escape, not escaping from life, not trying to just get into some other world and stay there, but to learn something about your own life by temporarily escaping your own sort of biopsychosocial illness experience, and the sense of awe and wonderment that can solidify the positive feelings one could experience if they're leveraged correctly. And so I want to show you now an example. This is two computers, and I'm going to animate this in a second, and I'll explain what those are in a moment. But in this room is a patient of mine who has chronic pain, abdominal pain. She has irritable bowel syndrome, or IBS. And she's had very severe pain for quite a long time, has received many different therapies that have not been very effective. She's received antibiotics to try and change the microbiome in her gut. She's received tricyclic antidepressants. She received ketamine. She got a bunch of different medicines. And on top of all of that, she tragically lost her son in a car accident 6 months before this video was taken, which, as you can imagine, only worsened her biopsychosocial illness experiences. And so what you're looking at here are two computers. And when she came in, she was in a lot of stress and anxiety. And on the left, you're going to see the biosensor data coming off of a VR headset. And on the right is a two-dimensional view of what she's seeing. It really doesn't do justice. She feels literally like she's on a beach, and she's floating over water, and there's a mandala expanding and contracting in front of her. And so as she breathes in and breathes out, she can see her breath coming in and out of her mouth. And again, it's hard to tell here. But when she came in, she was in a lot of stress and anxiety. And this is called the cognitive load. This is a composite measure that is looking at her heart rate variability, and eye tracking and pupil diameter. And as soon as we started the virtual reality, there was a collapse, essentially in her sympathetic nervous system, to the point where we almost thought she was hypnotized because she was just seemingly gone. And we asked her, "Are you okay?" And she said she was fine. And then right about here, roughly 6 minutes in, she started to cry. She said that she was in heaven with her son, which was a very, striking thing to say. And we asked if she wanted to come out, and she said no, she wanted to stay in. Right about here, roughly 12 minutes in, she said she was in the presence of God and was having sort of a religious experience in the virtual reality. And we see this actually quite a bit. It doesn't happen with everybody, it doesn't happen every time, but when it happens, it's extremely powerful. And we see this quite routinely. It turns out there was a reporter from the New York Times, Helen Oyang, who's in the room for this video, and she wrote an article about what you're seeing here. So you can go online, find Helen Oyang's article on the New York Times. And so when this happens, I will often show this picture. This isn't just a slide that I'm showing for fun. This is an actual video that I use in my clinic. And what this actually is called is the glass brain. It was created by a friend of mine, Adam Gazzaley. He's a neuroscientist at UC San Francisco. This is actually his brain. But what he's demonstrating here is the dynamic nature of the brain, the higher order networks that fire off inside of the brain to govern the entirety of the brain. And this is one of the major advances of modern neuroscience, is recognizing these higher order networks that cut all the way across the cerebral cortex in every direction. And I show this to a patient like the one I just described to debrief. And I'll say, look at this. What just happened in your brain just now? Because we didn't give you a medicine, right? We didn't inject a needle into something. We didn't do some procedure, but you feel better right now. What happened? And then I explained that, your brain is not like a block of Play-Doh that rattles around in your skull. It's a shape-shifting organ, like any other organ in your body. Not only that, it's connected to the rest of your body. In fact, every tendon, every organ, every bone, all of that is an extracranial extension of your brain. It's the part of your brain that's not in your skull. It's all one system. It's all one system. Mind and body are not separate and distinct like Descartes would have had us think. It's one continuous, fully integrated, holistic system that's taking in the data from the world around us like a computer does and compressing it again until it forms a narrative in our mind that we call consciousness. And what's amazing is that even when we are in physical distress, we can still modify how our brain perceives our body. We have that capability. That's the power, of course, of neuroplasticity. It's the ability to change the actual apparatus that is sensing the world around us. And you just did that. And I explained to them that this may not have cured your IBS, let's be clear. But if we work at this every day for the next 8 to 12 weeks, then maybe we can start to change a little bit about how you're experiencing your pain. And that's what we do. We have an 8-week cognitive behavioral therapy VR-based program that we use that I'll talk more about. Now, I've shown you 2 experiences here so far. On the left, me jumping off of a building, feeling very stressed, very anxious. And on the right, Trip VR, where people can feel as if they're in these fantastical cyberdelic worlds, and this sense of oceanic consciousness results from it. We recently, about a year and a half ago, did a study where we actually randomized people between these two conditions. And we measured all sorts of things in their body. We measured their cortisol levels, their white blood cell count, their body temperature, their heart rate variability, and a bunch of other outcomes. And these were the results of that study. And what you're looking at here are two images amongst many others in this particular study. On the left, for example, heart rate in the stressful experience versus the relaxing experience. Not too surprising that heart rate goes higher in the stressful experience. On the right, we're looking at a heat map, looking at changes in cortisol levels. A little hard to interpret all at once, but we did see shifts in cortisol levels. And this isn't over the course of days or weeks, it's over the course of minutes. Over the course of 15 minutes, we can change cortisol, we can change body temperature. I was amazed to see changes in white blood cell count. That's quite amazing to me that something like your circulating white blood cells could be altered within 15 to 20 minutes from a simulated experience of the world. It makes one wonder, are we already in a simulation right now? Is this a simulation that we're in? That's a hard question to answer. It's a philosophical question that many people have debated. It may sound preposterous if you haven't thought of that. And it may not matter, by the way, if we're in a simulation or not, or what do we mean by that? But certainly it's true that the world around us, as we experience it, bears no resemblance to the actual base reality. The quantum mechanical reality of the table in front of me right now that's holding this computer up looks nothing like a table. Nothing. Our brains are user interfaces that take in essentially quantum mechanical data and collapse it into an experience that's sensical to us. And so in some ways we are living in a form of a simulation, but whatever we want to call it, what we see in this study is that an actual simulation within the simulation can very profoundly change our biology. And that's an aha moment that has been driving a lot of the work that we do. And it leads me to conclude that virtual reality is a form of genuine reality. It's genuine insofar as these virtual simulations do very genuinely affect the human body. And this can be done to cause people a great deal of anxiety and stress or anger or other negative emotions, or if used correctly in the right time, in the right place, and in the right amount, can be used to support human consciousness, to be beneficent, an ethical use of something like virtual reality. Now, we'll talk more about how we use it, and the goal is to use it for no more than 10 to 20 minutes when we use it, and then for people to stop using it when they don't need it anymore. And I'll talk more about how that works and what our outcomes have been. But what I will say is when we use it to recalibrate unhealthy perceptions of oneself, of the world around them, VR has this potential to become a radical therapy to improve quality of life. And that's been the work that we've been looking at. Now, a lot of this began quite a while ago. You can see here in this picture a rather low resolution image of snowballs getting thrown at penguins and a woolly mammoth in some kind of an icy world. This is called Snow World. And this was one of the very first demonstrations of how virtual reality can profoundly improve human health. And these studies on the right are all the way back from 2004, 2000. This is not new research at all. And even this low resolution screen was able to help people profoundly. And in this particular line of research run by Hunter Hoffman at the University of Washington, they looked at people experiencing severe pain, the kind of pain that you have when you have burn injuries. These were people who are undergoing bandage changes for burn injuries, one of the most extreme pains a human can endure. And they were randomized in various studies between virtual reality or no virtual reality. In this study on the right, this randomized trial, a famous one from 2011, the black bar is the virtual reality and the white bar is the control. And what they were able to show is not just the intensity of the pain, but also how much time were you thinking about the pain? How unpleasant is the pain? And then this curious outcome of fun, which is not an outcome you typically see in a burn trial. There was more fun had, in addition to less cognitive, affective, and sensory components of pain. Now, they also did research looking at functional MRIs of the brain, and this is an important study from 2007 where they used this magnet-friendly MR headset, so they were able to actually wear the headset in the MRI scanner. And what they did in this study is they exposed the research participants to a painful thermal stimulus on their foot. So it was like a hot probe. And the hot probe, as you can see, caused a sensation of pain. And you can see that on the left. The flames here, they look like, the flames in a way, in the sensory cortex of the brain, but also in the limbic system and the emotion centers. And we know that pain is not just a physical experience. It's very much a cognitive experience and an emotional experience. And there's a psychology to pain as much as there is a physiology to it. And what we see with virtual reality in this study is it tamps down the signals in both the sensory cortex and very much in the limbic system and in the insular cortex. And so this research indicated that at least in the short term, virtual reality could tamp down pain. How it's doing that, it's still a bit unclear. Is it pure distraction? It may be. It may be distraction, particularly for acute pain. I'm going to talk about chronic pain as well. But there may be other factors too. We have descending inhibitory pathways, which means that our brain can send signals down the spinal cord to close the so-called virtual gates that let pain into the spinal cord from the periphery. So we do have an ability to shut down pain signals from rising up into the brain. And when we're in a state of calm and relaxation, it's almost like your brain saying, I don't have time for pain right now, so I'm going to temporarily close the gates. And it may be that virtual reality is able to do that. Now, I've been talking a bit about acute pain, but we know that chronic pain is different. Chronic pain is a disease unto itself, whereas acute pain is an expected physiological response to tissue injury. But when the tissue injury more or less heals, but there's still persistent pain months later, then we start to transition into chronic pain. And chronic low back pain is the most pervasive form of pain in humankind. And that's to be expected because we're standing on a planet that is pulling on us in the form of gravity. Our relationship to gravity is like a fish to water. The fish is designed to survive and thrive through and with water. It hardly even thinks about it. It probably has no idea. And we are designed to survive and thrive in a gravitational field. That's literally what we do every day is we stand up and we stay up as long as we can and as well as we can until eventually we can't. And then we get pulled back down. And so low back pain is a consequence of that, a consequence of the strain on the body. And so what this study was is a randomized controlled trial, not of opioids, not of NSAIDs, but of virtual reality. It's a 56-day FDA-cleared VR therapy that is a daily form of cognitive behavioral therapy. It's not exactly CBT, but it's a skills-based training in virtual reality to help people learn how to, think differently about their pain. And the goal is to take the headset off when you're done. And in fact, many people don't really want to keep using VR. In some cases, it can cause some cyber sickness, some nausea, some dizziness, particularly if you've used what I call bad VR, being on a roller coaster and moving around. We have relatively low rates of cyber sickness because we use steady horizons and we try to minimize a lot of movement. And there's some sort of science behind how to reduce what's called latency between the inner ear vestibular system and the eyes. And so the software that we use tends to minimize that. But anyway, this was a VR versus sham VR study. And when they followed patients with back pain for 56 days, they found a larger reduction in the group receiving the VR therapy compared to the sham. And in the sham, they wore a headset, but they just looked at pictures of basically animals walking around. Not particularly exciting, but it controlled for actual use of the headset. Now, there's a lot of discussion about the best way to do these studies and what's the best control and so on, but this was a very important demonstration that chronic pain could be modified, not just acute pain, using virtual reality. Now, it's our hospital at Cedars-Sinai. We have the largest hospital in the Western United States, and we like to think of our hospital as, a laboratory for digital health innovations. We work in partnership with our patient partners to find new and different ways to use technology to improve their experience, and can talk about lots of different programs that we have, but today I'm going to focus on the virtual reality programs. And if you go into a hospital like ours or any other hospital, this is what it's like. I took a picture of a typical hospital room, and let's be clear, this is not a place of rest. This is not a place of healing. Patients in these rooms are experiencing biopsychosocial distress. I keep using that term. It's the physical, emotional, and social impact of having an illness and being in a room like this. And all day long when you're in a room like this, you sit in the bed and you look up at the ceiling. And every so often somebody like me comes by, not necessarily smiling, pushing and prodding, and then we disappear. And then we come back again, and then we disappear. And all day long, that's what's happening. And we thought, what if we can do better than that? What if we can give people a chance just to escape those four walls, to go to fantastical destinations? In this case, this patient is reaching out to a blue whale that's swimming across her visual field. And we spent some time early on just talking to people and finding out what works, what doesn't work. Do they like this technology? Would they use this? How does it feel on their face? Where do they want to go? And people said that they wanted to go all sorts of places. Some said they just wanted to go to Hawaii and hang out by a waterfall, or maybe go on a safari to Africa. And we learned a lot in these early days with our patients doing this qualitative research. Eventually, we developed a whole program that we call virtual medicine, or VMed. And this is Dr. Liran, our psychiatrist, who also programs a lot of our software. And for a while, we were using this mobile cart that we moved around the hospital, and it has a UV light box in it to clean the headsets between uses, and it had a special computer system on it. We don't even need this anymore because the software and the hardware has gotten so good that it's all self-contained, and I'll show you more about that. But I want to show you now some patients using virtual reality for the first time at Cedars-Sinai, and you'll hear some music. That's the actual music that they're hearing. And the first patient has a sickle cell disease, and I showed you a picture of her before. And the second has advanced cancer, experiencing significant pain. And again, both have allowed us to show their images here. That's all right, no apologies. Yeah, we see that a lot actually. Get a lot of people that get emotional. Right.
I don't even have the words to explain it. It's beautiful. It's touching that you guys are doing something that's so great. Being in here and being able to just escape what's going on. Yeah, just when I'm like, ooh, I could just sit here, especially on the lake. I'm like, shoot, I could pretend like I got some barbecue. That's all I need. And just chill there all day.
So you can see the emotional experience that she's having there, and how moments before she was in pain, and then after a simulated world, not an injection of medicine, not a procedure, she had tears. She had an emotional, physical response. That virtual reality was a genuine reality for her. And then the goal becomes, well, is that a sustainable experience? And what we've seen, which is amazing, is in many cases, people's pain goes away for a while. In some cases, not for long, in some cases for hours, in some cases for days. There's an analgesia tail that's been described. Now, it's one thing to show pictures and images, but it's another to do the research. And so we had been seeing a lot of these experiences. So we decided to do a randomized controlled trial. This was an unfunded study using a randomized design among patients in the hospital who were experiencing pain. And we had 140 participants. They got eyes between using virtual reality. They were given the headset. They were told, or they were requested to use it for 10 minutes at a time, 3 times a day while they're in the hospital, and as needed for breakthrough pain. And the other group had an intervention too. It was a 2-dimensional screen. It was their television set, where we had health and wellness programming on the television, which is what we normally do in the hospital. And so that was the active control. And we then just followed them and allowed the nurses, who were not part of the study, to monitor their pain scores. And what we found over the course of the hospital stay is that the patients in the VR group had a larger overall reduction in their pain compared to those in the TV group. And it was particularly notable for those with significant pain, scores of 8, 9, or 10 out of 10. Those individuals had the largest reductions in pain in this randomized trial. Now I want to switch to another use of virtual reality that is really quite shocking, actually. And to explain this, I want to tell you about how I experienced it. I went to the University of Barcelona, where Professor Mel Slater is doing very interesting research, and he has a very interesting lab. And in his lab, there's this room. And this is a room with a table and a chair and black curtains. And he had me sit down in this chair and kick my feet out on the table. And then this is Ramon Olivas, one of his postdocs, who set me up with a virtual reality headset. And they put a VR headset on my face, and next thing I know, that room turned into this. I'm looking around and I'm noticing this wood paneling and a large chandelier, and I looked down and I noticed that there are some legs there. And I thought, that's interesting. Whose legs are those? Then they drew some blue lines on the table and asked me to move my legs to trace out the lines. And sure enough, in perfect one-to-one synchrony, as I moved my legs in real reality, these legs moved in virtual reality. And I started to wonder, how is this happening? I knew there was a computer in this room running thousands of lines of code convincing me that that's my body, like the Matrix style. Well, next thing he did is he dropped some balls from the ceiling, and as each ball hit me, I could feel it. It would literally vibrate. There was a vibration engine that they put on my ankles and wrists, and it felt like those balls were hitting me. At this point, I had what's called full virtual embodiment, and it felt like I was literally in this body. Well, what he did next is very hard to put into words. I'm going to just show it to you, but you just have to try and imagine that you're in this space. You literally believe that's your body. And the next thing you know, he detached me from my body, and I started to float up to the ceiling. Those balls kept hitting me, reminding me that I was still some kind of a self, but I looked down upon the body that I had just occupied, and I noticed that it wasn't moving at all. It was vacant. I was having a full out-of-body experience. I had basically died a virtual death. And it's a bizarre experience, and I'm going to show it to you again here. And I realized as I was floating up there that it was so striking to see myself still. But it also wasn't catastrophic. There's something about the process of dying that maybe felt a little spiritual, but at the very least, it wasn't catastrophic. And that's a major aha moment for me. And it turns out that they've done a study. A virtual out-of-body experience reduces fear of death. This was a randomized controlled trial where they took undergraduates at the University of Barcelona. They randomized them between this experience I just showed you versus another experience where you float up, but you can control your body. It still is moving. It's just like... And then a week later, they followed up with participants, and they asked them about their fear of death. using a standardized questionnaire. They didn't know this study was going to be about fear of death. It turned out there was a significant reduction in fear of death among young undergraduates who experienced an out-of-body virtual experience compared to those who didn't. What this shows is that VR is really a tool for perspective taking. If it's used correctly, it can allow you to reframe your sense of self within the world. And so now I want to show you what we've been doing as I start to wrap up here, using the Apple Vision Pro, which is a new virtual reality headset, rather expensive one. It costs a lot of money, but it is quite amazing. It has 23 million pixels and an 8K display. And what we're doing now, I'm going to show you in a video, where what we do in the hospital is we work with our psychiatry department, and before they go in to see the patient, we can administer, for those that are willing, of course, this VR headset. And then our patients are able to sit in a room, a virtual room, and talk to a robot. It looks like a robot on purpose, as you'll see, because they're not talking to a human, they're talking to an AI. And they know they're talking to an AI. I'm going to show you how in a virtual world, a human can talk to an AI robot and get mental health support in concert with their human therapist. And that's the key, is we must have humans in the loop. So I'm going to show you now what this looks like, and we call it GR, or generated reality, which I consider the next evolution in tailored virtual worlds, where the AI is going to select the music, the visualizations, the effects, depending upon what the person is talking about. So this is what it looks like. This music is actually produced for the software. The VR will select what music is correct. This is the robot. Her name is Zaya. She's deployed some rainbow-colored butterflies for this particular patient. She has 150 different facial expressions. She'll look you in the eye, she'll smile, she'll frown, she'll look away. You might decide that you need to relax in a forest, or maybe she notices that you're getting a little too stressed, so she might change it into some kind of a bioluminescent world. She has different things that she'll say and do, and it's very specific. If somebody's talking about their gender identity, maybe rainbow-colored butterflies are the right thing for her to deploy. There's 6 different AI systems working together to create this world. And at the end of the day, after she's talked with the patient, she's actually going to write a note, and she's going to put that note in the chart, and she's going to send it to the therapist. And this is literally, this is a study where we validated this. This is what's happening in the background, is we have a whole complicated system here. One of the things we have is we have one AI watching the other AI. So if the first AI were ever to say something stupid, which we haven't seen yet, but we have to be prepared for AI to be stupid, we have a second AI that's monitoring the first one, and we have a human in the loop. If there's anything that comes close to suicidal risk or anything concerning, immediately the therapist gets an email, an SMS text, and an alert through the electronic health record. So this is all done in partnership with therapists. This is literally the note that VR robot writes and puts it in the chart, and then a human needs to see this patient and has access to the full note. We're studying this now to see what people think of it, and it's been striking how engaged people have been with this system. But again, we can't replace human therapists, nor should we ever, but we can use technologies to help support it. So I'm going to end there, and I just want to say that this field is now called medical extended reality, or MedXR, MXR, and we now have CMS support for it, and we have a journal, the Journal of Medical Extended Reality, and we put on a conference every year. Actually, this conference is next week. It's March 25th and 26th, and we bring in the world's most creative technologists who come into Los Angeles every year, and it's an in-person conference, because we do a lot of hands-on demos, and you can actually see the technology and use it. If you're in Southern California, you're interested in this, you can take a look at the Virtual Medicine Conference, which is next week, and you can check out the agenda. And this is just a few, pictures of what the conference is like and people using fun things. And I'm going to end. I have 30 more seconds left, so I know I want to get to questions here, but because I see Bonnie, you're up there. What I want to end with is, rather than pictures like this, which is what most people think of when they think of VR, I think we need more pictures like this of how this is how at Stanford University they use VR with their kids to help distract them during painful procedures and help them get through emotionally charged experiences. Rather than pictures like this of people falling down or falling through TVs or whatever, I'd rather see pictures like this. This is an individual with advanced dementia, and at this moment she is experiencing a childhood memory of being on a beach. But moments before this video was taken, absolutely in distress and crying out. I'm going to show you now what happened when they started the virtual reality.
Gonna see. I'm gonna see. I'm gonna see. I'm gonna see.
Beautiful.
Oh, look at it. You wouldn't believe this was there, would you?
No.
If you didn't come here to see it, you would never know that it's even blue.
It is blue.
Oh, it is blue.
For the opportunity and happy to answer any questions you may have.
Thank you, Dr. Spiegel. Your presentation was amazing. It covered all of the questions basically I had prepared for you. So I'm going to turn this directly over to a lot of the individuals who have questions now. There's quite a few of these questions are around, how do I get this at home? What can I do? Yeah, do I have to come see you at Cedars-Sinai to get this, or how can I take advantage of it?
Yeah. So yes, you can get this at home, and probably the easiest way to do it is to purchase a Meta Quest headset. And again, I have no relationship to Meta, not pitching any of their products, but they happen to have probably the most cost-effective headset. Cost about $300, between $200 and $300 to get the headset. So not necessarily cheap, but it's a lot less than a smartphone. And when you get the headset, there's an app store, just like there is on a smartphone, and you can download different apps. And there's thousands and thousands of apps now. So, I do a lot of exercise and simulated boxing, for example. You can meditate. There's the software Trip VR I mentioned a couple times. That's TRIPP VR. I particularly like. It has probably the most evidence. We do have some software on there too, but I think you can explore what works for you in VR. Yes, we do have trials at Cedars-Sinai. If you happen to be a patient at Cedars, you can ask for the VR and we'll come by. And we have a number of active research studies that we're doing. We're doing one right now for inflammatory bowel disease, or IBD. We've just actually finished one for IBS. We're very excited that that study is positive, and we'll be presenting the data in Chicago in May at the Digestive Disease Week. It's the first study to demonstrate that 8 weeks of VR therapy can be extremely effective for the pain, abdominal pain, actually. And so I'll stop there, but those are just some thoughts.
Yeah, thank you. on the extended use of VR or the effectiveness after that session, right? So can you just remind us or walk us through what your recommendations are for continued use? So it sounded like your sessions were maybe 8 weeks long, something around that line, right? And then, after that, are people still are experiencing pain? And then what is your recommendation for them after that for post
Yeah.
VR?
So we now have data up to 2 years after VR for back pain that there are still persistent differences between the groups, even after stopping the VR. So in those studies, it was an initial 8-week therapy, and then they just stopped the VR, and there's still persistent benefits. And that's because of the rewiring, right? The whole goal is to use the VR to sort of accelerate and standardize the process of cognitive behavioral therapy or other forms of cognitive therapy. And what we generally recommend is when we use VR in our patients, we don't use it every day. There is a weekly session where you use it for about 20 minutes and learn something new, but you can use it throughout the week as needed. And there's also an app that goes along with it so that you can reinforce some of the learnings on your two-dimensional screen when you're back in real reality. We don't want people to live in virtual reality. We want them to learn something about themselves, their mind and body, and then stop using it after the 8 weeks are over. But it's always there if you want to go back to it for kind of a booster shot, so to speak. So that's our experience, but we're still doing a lot of research, NIH-funded research to learn in whom does it work and how long does it work.
Yeah, thank you for that. So I want to encourage everybody, please answer, if you will, the poll on our session. Just take a few minutes and do that. We've got time for one more question from Dr. Spiegel. And I want to ask that question is from the responsiveness standpoint, right? Can you give us some insight into how your software and the systems you're building is being responsive to those individuals that are making progress and adjusting then what you're doing back? Is that the AI that's doing that or what other,
Yeah, so during the sessions, the AI is actually, in a way, scoring, and if I had more time, I can actually show you literally data, how it works. It's quite amazing. But it is constantly monitoring the quality of the session. So it's looking at the sentiment, it's looking at the tone of the language being used, and it's trying to meet the individual where they are and slowly pull them up. And what we find is that if it does it correctly, after about 12 to 15 exchanges, the VR therapist will entrain the user and start pulling their tone up. And it's doing that by very carefully calibrating in each exchange what not only tone does it need to hit, but what topics and how does it approach the use of language in that individual. And it turns out it's different for different people, and it will very quickly determine what seems to be working and what's not working. And it might even completely flip what form of psychotherapy it's using. It's not required to use one form of psychotherapy. It'll keep experimenting until it finds one. And it's changing the world around the person using different metaphorical visualizations that hopefully will work. And then if we have access to heart rate and heart rate variability and pupil diameter, we can use biosensor data to actually see if it's changing the nervous system, and then it'll follow any positive feedback and hone in on those signals. So that's what we're working on right now.
So fantastic. It really, this is just so fantastical. And not in a fantasy way, but just in the results that you're getting from it.
Yeah.
Yeah, and what I love so much about your approach and how you're integrating here is this word biopsychosocial, right? It is the comprehensive, the whole body that you're taking into that, including the spiritual component of that, which we haven't talked about very much here in this summit. It's not talked about very much at all in the healthcare field, and how you integrate all of those into this system is, I think, very unique, and I think part of the reason why you're getting the results you're getting. So I applaud you for that. I really do. And I think you can see from the comments that that's been a big part of what's got people's interest in this. How about the last question? We are really out of time. I think we could talk for another half hour, but we're out of time. So the last question is, how would somebody go and find this? So if you're not going to do it at home, you want to go find a physician or a therapist, something like that, to use VR. Give us the top 2 questions they need to ask to make sure they're getting a quality system.
Yeah, so there still aren't near enough therapists who are using this, but more and more are. And, I think it's worth, if you are interested in this, and if you have a therapist, ask them if they're familiar with this and what they think about it. What I'm finding is the most kind of open-minded and modern therapists are extremely open to this opportunity. They see it as an adjunctive therapy. Those are the people that come to our conference every year. And, they may have their own opinions about the best software, but, and I don't, want to keep pushing one software program over another, but it's hard to answer this question succinctly. I would just say, talk to your therapist if you have one and see what they think about this technology. And they may lead you into certain directions that are beneficial for your personal situation.
Okay, sounds good. I think that's a great note to end on. Thank you so much, Dr. Spiegel. I appreciate you
Okay.
taking the time to put together such a great presentation and join us.
Thanks very much. Take care.
Bye-bye.